The initiative introduces portable ultrasound technology directly to health facilities, bringing imaging closer to patients and reducing delays in diagnosis. In Uganda, where maternal mortality remains a concern, estimated at over 180 deaths per 100,000 live births, delayed diagnosis continues to cost lives. Experts say POCUS could significantly change that by enabling quicker detection of complications such as ectopic pregnancies, fetal distress, and internal bleeding.
I've been seeing challenges at night where you think about having a scan for a certain mother, but you can't access it. Most of our sonographers work during the day and sometimes 2 or 3 days in a week. Most of you can't know what a midwife goes through at night when she would have known what to do, but she can't get access to it. You feel like hands are tied. You feel much pain, which no one else can explain.
What problem we are addressing, we have that clarity. My colleague Ebong mentioned it, that we still have 10 to 15, between 15% of all pregnant mothers have complicated pregnancies. 15%. We have a very low coverage of ultrasound services. Our aspiration as a country, we are at 28%. Only 28% of the women in Uganda are able to access or afford an ultrasound scan over their pregnancy. 9 months. But actually, it's also very expensive, DG. In the rural areas, I was in Shema, they told me it's 15,000. I was in Maracha yesterday, they told me it's 20,000. Accessing an ultrasound to know those basic things. Is your placenta well positioned? Is the baby alive with a fetal heart? But you also forget we also have so many abortion cases. This same gadget can help you to find out whether the abortion is complete or incomplete. And that abortion is one of the biggest killers also in this country.
The ministry says the integration of POCUS into routine care will also ease pressure on referral systems, cutting unnecessary patient transfers and improving efficiency across the health sector.
One important thing is being able to pick routine data about functionality. Where we are as a country, we no longer have redundancy of throwing things that are not going to work. We want things that are going to be used. We want things that are going to change the care outcomes. We want equipment or technology is going to transform our care system.
Where the POCUS comes in hand, and which are basically AI driven, to ensure that even a nurse is able to use an ultrasound, because with the AI function, it's just about empowering them with the skills on how to use the ultrasound, and they're in position to give or understand the status of the baby. Why we do this is basically to ensure that we are able to understand that these equipment are functional or not. So we have a system that we are trying to integrate with the Ministry of Health, where we are able to understand that, okay, we have a POCUS that is in Kalaki Health Center 4. But this system is able to show us that it has been off for the last 10 hours or the last 2 days. So the question is why? Yeah, what we are trying to avoid is equipment redundancy.
The rollout will prioritize high-burden areas with a focus on reproductive, maternal, and child health services, aligning with Uganda's broader push toward universal health coverage.
So we'll be looking to how to start with the high-volume centers, probably the most difficult to reach areas or hard areas where we can be able to do that, and progressively see how we can be able to deliver it. Ultimately, we'll find to see how it can be transformed to part of the equipment, which is a much more smaller size, which a clinician can just put in the pocket Because if you had told me, I would have come with my clinical coat, you would have seen it. So the pocket is really, I think even this one can accommodate. So where you can friendly be what? Be able to do that so that when you move, you can be able to do one. But also we are looking at that, how can you be able to do it in community? And I'm sure, Richard, that if this is added into in the future, in the package of community extension workers, with the AI, I'm sure many people can be able now to be mobilized to do what? To attend antenatal. So let's think futuristically and be able to look at that.
As Uganda embraces innovation in healthcare, the success of Point of Care Ultrasound will largely depend on sustained training, equipment access, and system-wide adoption, factors experts say are key to turning this promising technology into life-saving impact. Walter Mwesigye, NTV.